Welcome everyone to the first episode of Little Rounds by Agaya. My name is Amir and I'm here with my colleagues at Agaya to introduce to you a series of episodes raising awareness about child development. I will start by introducing everyone here. Can you tell us more about yourself, Noura?
Yes. So my name is Noura. I'm a psychomotor therapist. So psychomotor therapy focuses on the connection between body, emotions, and attention. So what we do is we don't focus only on the skills of the child. We also look at how they are using their body. Are they aware of their body? Are they regulated? And in our sessions, we use movement, play, and sensory experiences to help children feel safe, more safe and organized in their body.
That's great. Sally, how about you?
I'm Sally. I'm the occupational therapist at Agaya. So what is occupational therapy? We help people do the things they want to do or the things they need to do. So if for any reason there's a barrier to what people want to achieve, we help them figure out why is there a barrier and how can we solve it, either by building skills, making adaptations, whatever way we can help them.
Asma.
Yes. Hi, Amir.
Hi, how are you?
Hi, I am Asma. I am the speech therapist at Agaya. So speech therapy, basically, we help children communicate. So regardless of the main reason behind, if they have any speech delay or language delay, whether it's a structural difficulty or a neurological disorder or any other reason, we help them find a way to communicate their feelings, their emotions, and their needs in the most appropriate way possible.
Okay, that's great. And again, thank you so much for joining here for this series. And I would start with the first question that it comes to any parent. Like, when should I be worried? And why? So in short term, everyone is usually waiting for some time, let's say for up to 5 years or whatever it is, then they will be worried. But we also in our life as a people who's working in child development, we have the word of early intervention, which is maybe it need more explanation by us to the parents and all of that. So Sally, how can you give your input for that?
So the wait and see approach is something we hear a lot from parents. Well, they'll come to us. It's like, I noticed these things, but I took my kid to a nursery or the doctor told me wait and see and let's see what happens. And sometimes it's valid, but most of the time, what we discuss always is early intervention and why that matters, right? If you're noticing something when your child is younger, especially between the ages of 0 to 5, at that time, the way their brain is developing is it accepts more knowledge, right?
Okay.
So teaching them at that age new skills or intervening at that point is usually more beneficial and shortens the amount of time that they'll need intervention. So the wait and see approach doesn't always work. I don't know if anyone wants to add anything.
So I want to build on what Sally just said about this critical age window. Okay, so I completely understand the point of view of parents who always want to feel or like the hopeful approach, like everything is okay, he will just grow out of it, or wait and see, like Sally said. But the thing about the child brain in the early years is its superpower. It's called neuroplasticity. Okay, so to explain this in simple terms, it's basically like we imagine that the toddler's brain is like a soft clay. You know, it's very easy to mold, right? So every time you talk to your child or sing with your child or play with them, you are actually molding this clay. You are building neural pathways and the child is learning things very fast. Like Sally said, like this is the critical window of learning and acquiring new skills. For us, if we will follow this wait and see, it's basically like us pulling up a chair and sitting there watching the clay, you know, goes harder, and then it will be harder to mold, right? So this doesn't mean that it will be hard to mold, like if we wait more. No, but we can put some water and make it softer and keep trying, but it will take much more effort and much more time. So this is why we need to switch from wait and see to maybe check and see, because there is nothing that you will lose if you, like as a parent, check with the professional, right, for their input.
Yeah, I like it.
So,
Check and see instead
yeah,
of
Yeah.
wait and see.
Yeah,
Yeah,
it's
and,
quicker.
and I just wanted to also add, like, something else we don't really talk about a lot is it's not just about the neuroplasticity of it all, but it's also about the children start to build habits, like especially when we talk about like coping techniques and coping
Yeah.
strategies, they start to build those naturally. And if they're building them in a way where it's not the most beneficial to them, the longer they're building those habits, the longer it takes for us to be able to break those habits, to be able to teach them new habits, right? So that's also another critical area where that early intervention piece can really come into play.
Yes.
Yes, I definitely agree with Asma and Sally. And also, we need to take into consideration that we don't want the science to develop into a more complicated problem because skills are very related. So, for example, if the child started with not engaging or not being attentive, he will not be able to do other skills.
Yes.
So don't wait. Just it's always worth checking whatever you see in your child. It's always worth checking.
Sure. That's what I always like tell anyone that I know, that it's if they have any worries, just do it. Go and check it. Maybe there is something, maybe there is none, but just go and check it.
Yeah.
Same as when we speak about doctor. If someone have any fever, he can take a Panadol, but in any other way, he should go and see a doctor to make sure that everything's okay. So, actually, this question, it's about the life here in UAE, because usually everyone have dual languages and dual nationalities. So, and we have this concern always from parents. Should I make my kid speak my mother tongue language, or should I make him speak the language which is common in UAE, which is English, or should I teach him both of them? I think this question will be more to Asma directed more than Noura and Sali. But this is the main. I think it's a main problem here in the UAE, and I can see it from everyone who's with me. So, what do you recommend us?
Yeah, I love this
Asma?
question. It's a very common misconception
Yes.
that parents usually say that if they notice the child has a speech or language delay, that it's better always to only stick to one language,
Yeah.
right? So,
Exactly.
as you said, in the UE, the environment or the demography that we have sometimes interracial marriages or anything, that the parent will be speaking one native language and the other parent will be speaking another language. And then we have English, which is the medium language of communication everywhere in UAE. So a lot of people will think like, okay, I'll just switch to English because it's easier, right?
Yeah.
No, it's not the right thing to do. And speaking 2 or even 3 languages will not cause speech delay. If a child has a speech or language delay, they will have difficulties in both languages,
Yeah,
right?
any language.
So we have to stop looking at the brain like it's a very basic, space where it's like only one filing cabinet that will only take one language in, and then if you put anything else, it will be disturbed. It's not like that, because the brain will develop single filing cabinets for each language, right? So actually, on the contrary, the research will tell us that speaking or being exposed to more than 1 or 2 or 3 languages even actually improves the skills, or the cognitive skills of the child.
Yeah.
Okay, so what we need to do in these cases is to ensure that we don't deprive the child from being exposed to their home language or native language, right?
Yes.
So we have different ways of doing it. We can have one parent at a time. So one parent will be speaking Arabic and the other parent will be speaking English or French or whatever the other language is. And make sure to understand that the child will actually learn English from exposure in the school or with friends or outside, okay? So no, speaking 2 or bilingualism or multilingualism does not cause a speech delay.
Yes.
It's actually, it improves the skills of the child, and we don't have to always switch to English to avoid that issue.
But in general, as a recommendation from your side, if they want to do it the right way, is there something called the right way with teaching our kid 2 languages? Like, what's the right way? Okay, should we split it for him, as you said, as an example, like keep it in the school for English and at home? Or no, it's better that parents will split the...
Yeah, so there are different approaches, like I told you. the most important thing is don't stop using the native language with the child, because one of the things that will happen, imagine if you don't understand your parents. Both parents will speak English and none of them, first of all, also it's not their native language. So they're not really giving a very rich language input to the child.
Yeah.
So the English language he's getting from them is also not 100%. You know what I mean? Second of all, when the child grows up and then they listen to their parents talking and they don't understand what they are saying, it's very disturbing, and it's not really emotionally supportive to kids. So the right way is keep speaking the native language. You can do it like context-based, okay, like home language or school language or family language. You can do it one parent at a time. So one parent will be only talking in English or whatever language, and the other parent will be talking in that language. Just don't mix both of them together. So don't speak Arabic and English like we do, right? I want kod batates and so on. We don't do this. I just speak full, completely
Complete
English.
language by one person.
Yes.
Okay, so we have a main concern with all parents as well, and usually you see it either the parents are doing it too much or they are not doing it at all, which is letting the kid watching anything in screens, iPad or mobile. So even yesterday, I was like sitting with families of my own, and I can see that one of my friends are not giving him the mobile at all. And then the kid is he's really upset because all the kids have the tablet. And then the others are just giving him the tablet and telling him, okay, just don't cry. So this question, I think for all of you, you can give us from your own perspective. I know Noura are enthusiastic about that. And she have a webinar about it, I think, to do that, speaking about it only. So we can start with you, Noura. What do you think? Is it actually delay if my child is exposed to a screen or to a mobile, to an iPad or watching cartoon, or no, or what play a factor for that?
Okay, so we have to know that we have different types of screens first. So we have the passive and the active. When the child is just watching a video on YouTube or playing something, or it's actually passive, he's not engaging much. The other type is the active. So, for example, if he's talking to someone through a video call or online learning, and the effects are different to each of these two types. But what I can say is that when the child is exposed to the screen, his brain is overstimulated, but his body is understimulated. Okay, so because when we are on the screen, we are sitting still, we're not moving a lot. So the body will need to compensate this after the screen. And this is where we see children will need to jump more, to move more. We see a lot of behavior, and also we see it affect their attention. It will become harder for them to focus later. And this is totally normal. So what we do is we advise parents to, of course, other than limit screen time, which is very important. And I think this is now very well known, we need to limit the screen time as much as possible. But also we can do some things. For example, we can offer our child to move a little bit before we sit down. Especially now with online learning, we can split the learning. Don't make it too long for them. Each 30 minutes, let's have a break. Let's move a little bit. Let's take a walk. So yes, I think there's a lot to do. And if you're interested more, you can watch our webinar, which is much more detailed than that.
Yeah, definitely. I had a look at it, and it's really interesting. Everything there. What about Sally? Sally, what do you think?
So I agree with a lot with Noura, what Noura said. And obviously, we all have heard the guidelines, right? Pediatricians have made recommendations, no screens from 0 to 2, all of these things. And all of these things are important. But I think the question you asked was, do screens cause delays?
Yes.
I don't think that's necessarily the case. What we need to understand is what screens actually do is they're impacting other things. screens can be impacting our sleep. Screens can be impacting our attention span, because if we're watching things that are super high paced, when we watch something slower, our brains are like, no, I want the high paced thing.
Yeah.
So it's not necessarily that they're causing delays, but they're impacting things which can start looking like delays.
Okay.
You know what I mean? And I think for me, like what Noura said about 2 different kinds of screen time is important. Like there is passive and there is active, but also within that, like not every show a child watches is equal, right? Like some shows they're more calm. And it's about like, you have to look at it in this way. It's about moderation. So limiting how much they're doing it. It's about also understanding when they're doing it. Like don't watch TV or iPads or things like that right before bedtime, because that's really going to impact their sleep.
Which usually all parents do.
Exactly.
So they can sleep.
Exactly. So they can sleep.
And then they are saying, he's
Exactly.
not sleeping. He gave me a hard
No,
time
exactly,
sleeping.
exactly.
Yeah.
And that's the thing.
Yeah.
It's like, yeah, they give you a hard time sleeping because you stimulated their brain right before they have to go to bed. Of course they can't sleep. And it's like, and it's also an understanding from parents that like, because you're giving a child a screen is not a bad thing. Like, because we also have to understand that the world we live in involves screens.
Yes.
It's unrealistic for us to approach this world assuming that we're going to block screens from our children's lives forever.
I don't think.
And then also the example you gave, right? Where one kid isn't getting it and all the other kids are getting it. Now he feels left out. Now he feels. So it's like, so there's different ways to look at it. But like I said, like as long as we're looking at moderation and timing and what they're watching or what they're experiencing, I think it'll be okay.
Asma?
Yeah.
What do you
So
think?
from a speech and language perspective, usually one of the also common things that the parents will tell me is that, but he's imitating what he's seeing on the screen, or he actually learned how to say ABC or some of the words or repeating some of the songs. But this doesn't really mean that he's actually, learning the skill. There's difference between being exposed to a skill or watching a skill and being, taught a skill. Okay. So for me or for everyone, language is like a team sport. This is how we, as babies and toddlers, and then start to learn language, right? By being exposed to language. And then it's like, they call it like a serve and return, like, like tennis. Okay. So a child babbles, for example, will say ba, 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 mom, whatever. And then the mom will give a reaction. She will give eye contact. And then she will say, oh, you won the ball, or so on. This is interaction, right? Screens don't give this interaction. Even the best educational show in the world will not like pause and then look at the child and then give eye contact and then give, answers or give them cues or prompts or supports to say something back. No, it's only like one way. It's like playing tennis, but to the wall, right? So it's not really what, giving the screen, but it's what the screens are replacing.
Yeah.
This interaction, right? So no judgment. If the mom is like, working so much and then she earned the 20 minutes of giving Bluey to the child, we will not be like, oh no, she can, no, she earned it.
Yeah, sure.
But not to replace every different, way of communication or exposure to language, right? It's a missed chance. We don't want to miss it.
Yeah.
Right?
Yeah. And I think what Asma's saying actually is valid for all development.
Yeah.
Like every skill our child's developing, it's developed, like learning through a screen is not as I don't know the word, like
Efficient, impactful.
yeah, it's not as
or
impactful
strong,
or exactly as learning from others.
Yeah.
So like all of these things that we have to think about with screens is not that they cannot exist, it's that they cannot replace how the child is developing.
Yeah, I got it. And maybe also, like I saw it also, and maybe it will be helpful that maybe sometimes you do the watching in screen with him together. So it will be like an activity between a kid and his parent and those, and it will make for him
Will be
more-
active.
and it will be him active, but at the same time he is watching.
Of course,
screen.
like a child watching a movie by themselves or a child watching with their parents who's asking them questions.
Yeah.
So they're like, it's a much different experience.
Yeah, exactly. So speaking about the expectation and what parents always, worry about their kids and what to be done and all of that. Usually by the age of 2 or 3 years old, the parents start to take their kids to nursery. And then we need to understand exactly the relationship between what can be done in nursery and what can be done in therapy. So usually if parents take him to nursery or takes a child to nursery, and then there is anything that needed there, we see this that when they come to our therapy center sometimes, that they think that, okay, we will bring him here and then leave the nursery, or they will go to the nursery and then leave the therapy. So I think this is a very important point that we need to speak about it a lot, because there is a big misconception about it.
Yeah.
That what is it? What's the relation between here, and are they related or no?
Yeah.
And all of that. For sure, we're not speaking that anyone replacing each other and any other one, but how can a parent who is in the nursery expect that they have to go and give their child something furthermore in a therapy like us, or vice versa?
Yeah.
Who want to start? Asma, you are more enthusiastic to speak about it, yeah? Or we give it to
No,
Nura?
so you see, this is what
Yeah.
also, again, something I hear so many times,
Yeah.
that, my child is not speaking well, or is not
Yeah.
putting words together, not speaking in sentences. So my cousin or my friend or my neighbor told me, it's okay that, he will be fine. If you will put him in nursery, he will learn everything,
Yeah,
and
yeah.
he will learn from the other kids. This is very common, right? So the first thing, please, parents, don't give this advice to each other. This is the first thing, okay?
Yeah.
It might be the case. Again, it might actually happen like this. Maybe one child was 2 or 3 and they are not
Yeah.
speaking, well for their age group, and then we put them in nursery and then they start speaking. But
Yeah.
this doesn't mean that this is for everyone, right?
Yes.
So just to make it very simple for parents, if your child, for example, cannot swim, okay, you will not take him and then throw him in the pool full of kids and say, you will learn from the other kids swimming by
Yeah.
watching them swim, right?
Yeah.
You will get them a swim coach, right? We are the coach. So kids make terrible speech therapists. We are much better. So the case is understanding that nursery is very important for socialization, for regulation, and sometimes understanding, how to be in a group, sharing, taking turns, a lot of social skills. And I think all of us will always recommend putting a child in nursery if they're not going.
Yeah.
But this is completely different from therapy. It doesn't replace therapy. It supports therapy at sometimes, okay? But it doesn't replace it.
Yeah.
It's completely different, okay? So here is, no, nursery does not replace therapy. It supports therapy. If your child will do better when they go to a nursery, is not an indicative that the child doesn't need speech therapy, right?
Yeah.
So the best course of action, if a child has some delay and I'm not sure if I should put him in nursery or not, I should simply seek the opinion from a professional, right?
Yeah.
Sometimes we will say, no, he's fine, he just go to the nursery. Sometimes
Yeah.
we will recommend this, right? And sometimes we'll say, no, put him in nursery and also start therapy, right?
Exactly.
Hope.
Yeah, I totally agree with Asma. I think same goes for us, because like the nursery, it offers the environment, as you said, for social skills, for routines, and it's very, very important. But if the child has poor attention, he's not regulated, he's not organized in his body, he's bumping into stuff or he's clumsy, he's not going to benefit from this environment. So in this case, this is where therapy plays a huge role. So we need therapy and nursery.
Usually we see that most hospitals or clinics or centers, they put multidisciplinary team. And to be honest with you, me, myself, as someone who's not from medical side, always before I work here, I was saying, what's the multidisciplinary team? Okay. So when I look at commonly, I can see that they have a lot of therapists and all of that. But when I started the work, I understood that it's totally different than we just have every single service in our center. So I think it's important also that each one of you can explain from their own perspective as well. What does multidisciplinary mean for the parents especially?
Yeah.
Thaddeus.
So for me, what multidisciplinary means is collaboration, right? Like you said, like we can have all these different kinds of therapies, and we can have, like you can have a hospital with all these kinds of doctors and all of that. But what we talk about when we talk about multidisciplinary is us collaborating together. It's us working together for the benefit of the child.
Yes.
So actually what a lot of research has been done and found is that if a child, for example, comes in and their parents are like, he's delayed in speech, right? So the speech therapist might do the first consultation and the speech therapist might be like, but also he can't sit down or his attention is not so good or he's not regulated. He's not following directions.
Yes.
And so then the speech therapist is like, oh, go see the OT, for example. And sometimes parents fight back on that and they'll be like, no, but like it's just a speech delay. It's like, no, a child is not one thing.
Yes.
A child is many things put together. So so sometimes what is key is for those different parts of the child, for the specialist in that area to help in that area. And then for all the specialists to come together, for all the specialists to come together and make like a shared response to what this child is showing. So that we're working together to create these goals. We're working together to see like which system worked for who, which concept worked for who, so that when we help this child in their development stage, we're able to share these things with parents as a team together. So that's what multidisciplinary means to me, at least. I don't know if anyone else has anything else to share.
You described it perfectly. I have
you.
nothing to add.
Yeah. So just like Sally said, that if a child has a speech delay, okay, speech and language development, they don't happen in, isolated.
Yeah.
There's a lot of other things required for a child to develop speech and language. Like Sally said, they have to be able to sit down. They have to be able to maintain eye contact. They have to be able to imitate what I'm doing, right? Or anyone else is doing.
Yeah.
So we work together. We address the same goals, but from different perspective.
Yes.
So we provide holistic care, right? Because you don't develop only one, the skill only by one person, right? So I will still work on joint attention where child shows interest in playing along or sharing along. Sally will do the same, Noura will do the same from different perspective. This is why multidisciplinary is very powerful. You get the best results when people actually work together.
Yeah, and anyway, in a lot of time, like also I saw that they will come that they are for speech therapy and then they need something
because
else
usually
before they do speech therapy. You need to do something, or maybe they come for OT or for psychomotor, but then they will say, please let's the speech therapist work before, or sometimes the ABA need to work as well with them before. So that's exactly what's the real point that we wanted to clarify here. So now, was anything that we speak about our kids and development, always we seek the answers for what's the red flags. Now, I know you don't like the question. However, if you can, each one of you, give me like any number of red flags that maybe it's not to generalize. This question will be the common one when we're speaking about kids and development. What's the red flags? Which red flags I should be putting in front of me when I am, raising my kid or checking his developmental milestones? I know this question is hard and you don't like to answer it because there's a lot of red flags, but let's try to generalize like as much as you can, each one of you. I would start with Sally. Sally, you're looking at me like I know.
No,
please let me
honestly,
answer.
it's because everyone else was looking at me. I don't like the term red flags. It's not my favorite term in the world that people use.
Yeah.
So there's many different ways that we can look at it. But the number one thing that the message I want to get across is I think parents should trust their intuition. Yes. I think if you feel like something is off, then it's better for you to go check. Like what we talked about before, right? Yeah. Just go check. Because it will help you feel comforted. It will, and if you don't understand if something's going on or something's not going on, ChatGPT is not going to help as much.
Yes, please.
You know what I mean? Sure, ChatGPT.
You know what I mean? It can help. It can be helpful. Look, we're not going to knock it, but check. Okay. So number one thing, parent intuition. That for me is the key. Yeah. And then when you want to talk about things to see, is your child playing with others? Is your child paying attention to things? Are they able to focus on something and do one thing at a time, or are they jumping from thing to thing? If your child is having emotional reactions, are they calming down in an appropriate amount of time, or is it sort of ongoing, right? These are things that you can look at that sometimes are important to see. And then the other ones, obviously, like you'll find developmental milestones for children and you can see how other kids are developing. And I also don't love that because I think every child develops differently. But it can be helpful in some ways as well. But yeah, I don't love red flags. I'm sorry.
Yeah. Actually, parents, when they come to us, they usually know, like, it's not hard for them to see some signs. So maybe they think of, or they come for only one sign or two signs. And then when we start talking to them, they will be, yeah, I see this. So it's not very common for parents not to see the signs. But yes, as Sally said, generally speaking, if the child has poor attention, he's dysregulated all the time, he's having a lot of tantrums, he has poor coordination, poor body awareness, he's very clumsy. So there are a lot of signs that we can...
Me now.
Yeah. I think I'm describing us. So yes, we can look at these signs, and whenever you see something, it's always worth checking, as we said before.
Asma.
Yeah, so for me, I will not tell you, like, you know, if your child is 18 months old, they're not doing this and they need speech therapy. I don't believe this as much, but as Sally said, there is a lot of, you know, resources online where you can check the developmental milestones for speech and language development. However, again, it's not a one thing that fits everyone, but it's a main guideline. If the parents have any doubts, they can check just to make sure that the child is doing fairly the same like his age group, right? The second thing, we can also provide, answers. If any parents have questions, they can share with us. We will be happy to help. Like if they will tell us the child is 2-year-old, they're not saying this, we're saying this, we can share with them some resources, or we can answer them in, videos later.
Yeah.
But for me, the parents should trust their guts for sure. But also at the same time, I completely understand and I'm completely empathetic with some parents who will be, I will not say in denial, but they are very hopeful that everything will be okay. So I want them to, the main thing is to check if the child is performing similarly close to his age group, right? Now, in Dubai, again, we have a lot of new parents, right? And we have a lot of parents who don't really have a reference.
Yeah, they're living by their own, and they're raising on
right.
their own.
It's not like back in the home countries where you have a very big extended family. So they will say like, he's not like his cousin or whatever. Sometimes they will have very limited exposure to other kids. So in that case, please check the developmental milestones that have scientific background. Please don't go to Dr. Google at 2 a.m. and say that my child is not doing this because you'll be depressed.
Yeah, for sure.
And if you have any more doubts, you can check with a professional.
Yeah.
And then we will let you know if, they are... one more thing for me is regression. So I would say that one of the, if we can call it a red flag, is if your child was doing something, they acquired some skills, they were already saying some words, and then they stopped, they regressed. This is one that I can comfortably say that this is a red flag. Then we need to check with a professional.
Okay, and for the subject of the kid having a delay, always parents have their concern about it, and mostly they always are afraid that if there is a delay, it means there's a disorder happening, or there's something wrong, major, or maybe this kid, maybe my kid will be, living his whole life in a certain disorder or whatever. So the question that I have is it necessary if a kid that any parent see their kid, is it necessary that a delay will cause to or be a subject of disorder, or there is some delays that are not related to disorder?
No.
Actually,
Delays.
I can see that there is firm looked at me.
The firm answer is not every delay is a disorder.
Oh.
Right? Like, I'll give you a very simple example.
Yeah.
There's a lot of kids with really bad handwriting. They don't all
I have a bad handwriting till now,
But that doesn't necessarily mean that they have a disorder causing them to have bad handwriting, right?
Yeah.
Sometimes it is, but sometimes it's not. So not every time we see that something is going off with our kid, it's like a disorder that's going on. Sometimes they just have minor delays.
Yeah.
What we talk about with early intervention is that the thing is that these delays, it's not linear. It's not like when they're 4, they're having trouble focusing, so that when they're 5, that trouble is the same. No, it becomes exponential because the expectations on these children grow more,
Yeah,
right?
sure.
So that's why we talk about early intervention, because sometimes it is just a delay. They're just a little bit later than their friends, or they're a little bit later than their class. And what we do is kind of just help them get to that. It's like you're giving them a boost.
Yeah.
You're giving them the boost that they need to get on the track.
Yeah.
But it doesn't mean that they have a disorder necessarily. Some children do, and some children don't. But I think from my perspective, at least, how I've worked my entire career, is that I don't really think it even matters.
Yeah, definitely.
Because you're kind of just looking at a child for who he is.
Yes.
Or who she is.
Yeah.
And you're working with them on what they have and what their concerns are and what their goals are and what they're seeing. So like, it doesn't always really matter that much.
Yeah.
Like sometimes it does for sure.
Yeah.
But for the most part, it doesn't really matter. So that's, it's just like we're giving them the boost. Like that's how I see us. I see us as like, we're giving them the leg up that they need for some reason.
This is exactly what I wanted to say. Like, even if the child has a certain disorder, like, and he has a certain diagnosis, we are not gonna wait for we're not, the support will be to help to support his skills, whatever the diagnosis is. It's just that we need to understand that sometimes the diagnosis will help us understand more this child, understand the origin of his difficulties, to be able to create an even more targeted therapy.
Yeah.
So it's not for to label the child, it's just to help support him better.
And one thing I wanted to add is that a lot of times we'll see parents or other people come to us and be like, does my child have to have a diagnosis to get into therapy? Not at all.
No, exactly.
Not at all. Like, no. Because we're not working on the diagnosis, we're working with the child. So if they're having issues, those issues don't start or go away whether they have a diagnosis or not. So I think that's just important to mention as well.
May I have anything to add for that?
Nothing to add. It's the same, like Sally said. See, one of the most common thing is, does my child have autism, right? So when
autism,
this is-
ADHD. You
this
know,
is-
you see some parents see maybe ADHD
They walked on
because
their
he's not
tiptoes.
completing every
Yeah.
task that he's doing. And then so why you are guessing?
Yes.
That's what I always
No, the number
say.
of children you have where they'll come to you and they'll be like, they're walking on their tiptoes. I'm like, yeah, and they're also looking at you and interacting with you and playing with you. And, but they're walking on their
lining up
tiptoes.
toys,
Yeah.
for example, or so this is the for me, like the most asked question: does he have autism? Does he have ADHD?
Yeah.
Regardless, like Noura and Sally said, we will still do whatever the child needs as per their current
To improve his skills
strategies.
and
Yes,
promote
yes.
his development in
Yes,
general, without
exactly.
no matter of any diagnosis. Okay, so there is a question that always come with that question or with that consent. Okay, a kid will come and then the parents, the first question, how much time you want to make my kid, let's say, tough,
Favorite
or for
question.
you, how much time you need for my kid to, improve his handwriting, or with Noura, it's the same. So do you think that we have a fixed time for our treatment? Now, for sure, I'm asking this to clarify. However, do you think that do we have a fixed time? Can we say that after 1 month or after 2 months or after 3 months, I can improve a skill or something like that? Or how is it working with you regarding timings?
Okay. I'll start. It's fine because
okay,
it's 100% my favorite question to be asked is, how long is this gonna take? I'd be like, I don't know, because I don't know. Like that's
No one does.
No one does.
Yes.
Because it depends on so many things. It depends on the child themselves. It depends on how regular their therapy is. It depends on what's happening at home. It depends on what's happening at school if the child's at school. There's so many different factors that go into how long it takes that me answering a question of how long will it take would be unfair. I would be lying to you.
Yes.
Like, I'll be honest with you. So I'll tell you things that can help shorten therapy time, right? One of them is early intervention. Often we find children, when they come earlier to therapy, that they require less time to reach their goals, right? Often we find if it's consistent, if parents are following through with some of the things we give them. If parents are also like supporting them at home, again, we find that helps reduce therapy time.
Yeah.
But at the same time, sometimes all of those things happen, but it still takes a while because for some children, they need more time to process some of the information they're gaining.
Yeah.
There's no one size fits all with anything related to what we do. I think is the most important thing.
Definitely. So I think that therapy is a process. There's no quick fix. There's no recipe that I see this child, I'll do this, and then we can stop. Every child is unique. Every child has his own needs. And for example, sometimes it takes a lot of time to even build a connection with a child. So we cannot say like this child will need this much time and this child will need this much time. It really depends on the case, as Sally said. And obviously, a lot of factors play a role, consistency and everything Sally has mentioned. Also, parents need to know something, that when they come for us to work on specific thing, for example, like handwriting, we work on a lot more than that. We cannot directly sometimes start with handwriting. For example, we need to sometimes to work on attention. We need to work on their planning skills, or how they organize their space, and a lot more skills than just the skill that the parents want us to start with.
Yeah.
So this also take much more time.
So like we all agree that every child is different. They have their own, unique neurological makeup, if we will say. Even twins, I've worked with twins before with the same diagnosis, and they respond completely different to therapy.
Yeah.
So we can never tell the parents how long it will take, right? But we can tell them the process that we will follow. So usually we will start first by doing a comprehensive assessment. So, for example, the child came to speech therapy first or OT first, then we see them. We do a comprehensive assessment. And then if they need multidisciplinary collaboration, then we refer internally to each other. And then we complete or finalize the comprehensive assessment. We set up the therapy goals. And like Noura said, it's very important that we set bite-sized goals. So we don't put like the final goal, like a child speaks in full sentences. This is not a SMART goal, like we call it, right? No, we take the small steps to reach that big goal, right? And we set some set of goals to work on. And usually we set the goals to be for us to work on them for about 3 months, right? And then we collect data as we work. We keep documentations, and then after 3 months we do review and see how the child, improved, what's their progress, right? Then we can sit together. We will see the child maybe achieved some of the goals, then we replace them, we move to harder goals or new goals. We actually reach plateau and the child is not improving, then we check what might be a different approach if we need, any. And then we report this to the parents, and then we keep going. So this is the process. This is what we can promise the parents, right? But we cannot have like, a crystal ball and magic and tell them that they will achieve this in that time. This is this is not true. So that's it for me.
Okay, so if we will be like wrap it up in a way that it can be as much beneficial for the parents as possible, is there any advices from any one of you of what to be done at home with the kid to make sure that they are reaching their development and they are living, let's say, a life that it will give them the right path for development?
My advice for the parents is, if your child is showing any delays, or if you're a little bit worried about their development, always check or take the opinion of a professional. The second thing is, if your child is going to therapy, speech therapy, any type of therapy, please know that the therapist, like therapy will not fix everything. If the child is attending therapy, he will be going twice a week, for example, right, with a therapist. But it needs a very consistent carry over at home.
Someone every day to
for the child to generalize and actually, learn the skill. So the role of parents is actually more important at times than the role of the therapist. If your child is seeing the best therapist in the world, but you're not following up at home, the results will take very long, right? So please follow up at home, and practice, and then you will see much better results.
Sally?
So one tip that is a very common thing I give like basically every parent I meet is use your routines.
Yeah.
Like think about yourself. You have a schedule, you have things that you do during your day, you have steps to your day. Children need that as well, right? And use those routines. So having a daily routine for your child is on one side going to help them with things like with their regulation, right?
Yeah.
It helps them understand what's going on with their day. That helps them transition throughout their day. That helps them feel less overwhelmed because it's predictable, right? But on the other side of that, you can use that routine to build skills, right? Because maybe we're using a routine where they have to remove a picture and tape it somewhere else. Oh, that's fine motor, right? Maybe during their daily routine, we're asking them questions.
Yeah.
That's speech. Like use your regular life to help support your child. Like sometimes I think we overthink things, but it's just like use what's there for you, what's already there. You don't have to do anything extra. I'm sure your child has a bedtime, your child has a wake up time. They have things they do during their day. Use that.
Even like when they are eating, we can
definitely.
apply a lot of things
course,
that you
yeah.
do, like simply by eating, right?
Yeah.
Of course.
Noura?
Yes, definitely, Amir. What I can say is parents don't need to do more than they already do.
Yeah.
It's just that they need to involve their children more. And it can be simply with whatever they were doing. For example, if they're trying to wear their clothes, let them point their body parts, let them talk to you. We talked earlier about screens. Engage with them, ask them questions. So it's whatever you do in your daily life, just involve your child as much as possible.
Yeah, so you know what, routines is very, very, very important for speech development as well, right? I always tell the parents, please, I understand that the parents, they have this magic, ability
Yeah.
to understand what's in the child mind before they're saying it, right?
Yeah.
If they look like this, he wants milk. So please don't give him milk directly. Give him a space or a chance to communicate.
To ask for
right?
the milk. Or to ask
Always
for what you want.
narrate what you're doing. Always talk about what you're doing during the daily routines, right? And okay, now it's laundry time. Mommy has the blue t-shirt. Let's put it in the basket. Keep the language simple, and it's very, very powerful because it gives you repetition. It happens every day, so a very good practice, right? And it's much better and natural for kids rather than just getting flashcards and sitting on the table and being, quizzing the child. They will not be interested, and it's not a natural way of teaching language.
Yeah.
Yeah.
Also the other thing is, just add to what Noura said, let your children help you do things.
Yeah.
Like I'll have parents come be like, oh, my child can't dress himself. And I'm like, so what's their dressing routine? It's like, oh, I put their shirt over their head and I pull their shirt down. I'm like, yeah, of course your child can't dress themselves. You're not letting them try. Like let them practice these skills. Like children learn by practicing things that they're
Even
doing.
if you do it in a clumsy
Exactly.
way, let him do it.
Even if he does it in a clumsy way,
Yeah.
even if it takes longer, even if it's like, let them do it, right?
Yeah.
And also let them do it in times where you're not going to be over their head and rushing them and like, oh my God, it's so stressful. You have to put on your shoes right now. It's like, no, like give them the time. Yeah,
It's a learning
exactly.
process. Yeah.
Yeah, I think that's it for today. Thank you everyone for joining me today at Little Rounds by Agaya, and hope you find all the information is useful. If you have any questions, you can always DM us on our social media. We will put the links for you in the description box. DM us any question you have. Only our therapist will answer you directly. Then you can find the links of our webinars that will happen next week and in the future. Also, you'll have some really useful links for resources given by our therapist here at Agaya. Thank you again, and see you next episode.